Your kidneys can lose up to 60% of their function, and you would feel almost nothing. Think about that for a second. 60%. That's more than half the organ quietly falling behind on one of the most important jobs in your entire body, and your day-to-day life barely changes. You still go to work. You still sleep, more or less. You still feel, more or less, like yourself. That's exactly why this is so easy to miss, especially after 50, when a little fatigue or a little puffiness around the ankles gets written off as just getting older. If you're over 50, this video is for you, especially if you've never had a single kidney issue in your life, especially if your last checkup came back completely normal. Now, you might already be thinking, my numbers were fine, my doctor said everything looked good, so this doesn't really apply to me. Stick with me, because that assumption is exactly what we're going to take apart in a few minutes, and the reason why might surprise you. Here's what I want to do for you today. I'm going to walk you through 5 specific signs your kidneys send out when they start struggling, signs that show up quietly, long before anything shows up on a standard blood test. I'm going to explain why that annual blood panel your doctor runs, the one you assume is watching your kidneys closely, can stay completely normal while kidney function is already declining underneath it. And I'm going to hand you a clear, practical plan to protect this organ starting today, along with the everyday habits and a few common medications that deserve a much closer look if you're over 50. I want to be upfront about something. My goal here isn't to alarm you. I've spent more than 3 decades in clinical practice, and if there's one thing I've learned, it's that fear doesn't help anybody make a good decision. What actually helps is understanding. Your body has been sending you information this whole time. It's just been speaking in a language nobody ever taught you to read. That's what we're fixing today. So give me the next 30 minutes. By the end of this video, you'll know precisely what to look for, what it actually means when you find it, and exactly what to do next. Let's get started. Here's the belief almost everyone over 50 carries around without ever questioning it. If my kidneys were in trouble, I would know. I'd feel something. Pain in my back, blood in the toilet bowl, something dramatic enough to send me straight to the emergency room. I need to tell you, as clearly as I can, that belief is simply not accurate. According to the most recent data from the CDC, more than 1 in 7 American adults, somewhere around 35 million people, currently have chronic kidney disease. As many as 9 out of 10 of them have no idea. And this isn't just early, mild cases. Researchers tracking this through a massive national health survey found that even among people whose kidney function has dropped severely, roughly 1 in 3 are still walking around with no diagnosis at all. In the general population, that number is even more striking. National survey data found that only about 7% of people with reduced kidney function had ever actually been told by a doctor that their kidneys were weak or failing. So why is something this common staying this invisible? I'm going to walk you through exactly what's happening inside your kidneys in just a few minutes. But first, I want to take apart 2 more assumptions that are quietly putting people at risk. Myth number 2, my blood test came back normal, so my kidneys must be fine. That single line on your lab report, the one labeled creatinine, is one of the most misleading numbers on a standard checkup. Your kidneys are built with an enormous amount of spare capacity. They can lose a significant portion of their working tissue and still keep that creatinine number sitting comfortably inside the normal range, because the healthy tissue that's left simply works harder to cover for what's been lost. By the time creatinine actually climbs high enough to catch a doctor's attention, a meaningful piece of that reserve is often already gone. I'll show you exactly why that happens in a moment. Myth number 3, and this one surprises people the most. Kidney disease is something that happens to people with diabetes or high blood pressure, and I have neither, so I'm not at risk. Researchers at Johns Hopkins, Bloomberg School of Public Health, publishing their findings in The Lancet, followed large populations across the United States, Europe, Asia, and Australia, and found that chronic kidney disease itself, completely independent of diabetes or hypertension, predicts a person's risk of kidney failure and death. A separate population study out of Spain, tracking more than 400,000 patients with kidney disease, found that roughly 1 in 8 of them had no diabetes and no hypertension at all, and their kidneys were declining anyway. So if you've been quietly telling yourself that this conversation doesn't apply to you because your sugar and your blood pressure are both fine, I'd ask you to keep listening. What's actually happening inside a struggling kidney has very little to do with which risk factor you think you're supposed to have. Now, what exactly are your kidneys doing all day besides making urine? Because that's the part almost nobody learns. Your kidneys filter your entire blood supply roughly once every 30 minutes. But they're also running your blood pressure control system. They're releasing a hormone called erythropoietin that tells your bone marrow to keep making red blood cells. And they're activating the vitamin D you take every morning so your body can actually use it. 4 full-time jobs, running quietly all day, every day. Here's how they pull it off. Inside each kidney, you have close to 1 million tiny filtering units called nephrons. Think of it like a swimming pool filter built with hundreds of individual cartridges instead of just one. If a few cartridges clog up or fail, the water still looks perfectly clear. The remaining cartridges simply work a little harder and pick up the slack. Nobody standing at the pool would ever know anything was wrong. That's exactly what's happening inside a struggling kidney. As nephrons get damaged, one by one, from years of high blood pressure, inflammation, certain medications, even normal aging. The healthy nephrons that are left just work harder to compensate. This is called renal reserve, and it's remarkably generous. You can lose a significant chunk of your total filtering capacity, and your labs, especially that creatinine number, can still come back looking completely normal. This is why your doctor's report can stay clean for years while the underlying damage is already building. Creatinine only climbs once the remaining nephrons can no longer keep up with the workload, which usually means a meaningful portion of your total kidney function is already gone by the time it shows up on paper. There's one more piece that makes this especially relevant if you're over 50. Kidney filtering capacity naturally declines with age, even in people who never develop any disease at all. That decline tends to accelerate after your 40s, which means the same nephron loss that a 30-year-old kidney could shrug off without a second thought is landing on a kidney with far less spare capacity to begin with. You're simply working with a smaller safety margin than you used to, and this is exactly why the symptoms that do show up tend to be vague, a little more tired than usual, slightly puffier ankles by evening, nothing dramatic enough to connect back to your kidneys, especially once you're past 50, when it's easy to blame everything on simply getting older. Let's get into the 5 signs directly, starting with the 2 that show up earliest and get dismissed the most. Sign number 1, swelling, especially around your ankles, your feet, or under your eyes in the morning. Here's why this happens. Your kidneys are supposed to keep sodium and protein where they belong, inside your blood vessels, holding fluid in balance. When filtering starts to slip, sodium gets retained instead of released, and protein that should stay in your bloodstream starts leaking into your urine instead. Both of those push fluid out into the surrounding tissue. The chief medical officer at the National Kidney Foundation, Dr. Joseph Vassalotti, has pointed out that this kind of swelling is one of the physical signs people notice, but routinely blame on something else. Standing too long, hot weather, a salty meal the night before. It quietly gets explained away for years. Sign number 2, fatigue that doesn't match your effort. You slept fine, you didn't overdo it, and you're still dragging by mid-afternoon. This one connects directly back to that erythropoietin signal I mentioned earlier, the hormone your kidneys release to tell your bone marrow to keep producing red blood cells. As kidney function declines, that signal weakens, red blood cell production drops, and you end up with fewer oxygen carriers circulating through your body. That's a real, measurable form of anemia, not just being tired. A large-scale patient database out of Japan, tracking over 30,000 people with chronic kidney disease, found that by the more advanced stages, roughly 4 out of 10 patients already had this kind of anemia present. And it doesn't wait until the final stages to show up. It can start quietly building well before someone would ever be told they have kidney disease at all. Both of these signs share the same trap. They're common enough and vague enough that almost nobody connects them to their kidneys on their own. Keep those 2 in mind, because the next 2 signs are the ones that show up in places you'd never think to check. Sign number 3 is a change in your bathroom habits, and it shows up in 2 different ways. The first is getting up at night to urinate once, twice, sometimes more, when that never used to happen. Your kidneys normally concentrate urine overnight so you can sleep straight through. When that concentrating ability weakens, urine production doesn't slow down the way it should, and you wake up. Researchers following patients at nephrology clinics, publishing in the Journal of Urology, found that frequent nighttime urination was present in nearly 2 out of 3 chronic kidney disease patients they studied, and it grew more common as kidney function declined and as patients got older. The second version is foamy or bubbly urine, especially foam that lingers instead of disappearing quickly. The National Kidney Foundation is direct about this one. Persistent foam usually means protein is leaking into your urine, protein that a healthy set of kidney filters would normally hold back in your bloodstream. It's an early red flag, and it's checked with a simple urine test most people have never had done. Sign number 4 is muscle cramping, often in your calves or feet, sometimes at night, along with occasional tingling or weakness that doesn't have an obvious cause. Your kidneys are responsible for keeping potassium, calcium, and magnesium balanced in your blood, all 3 critical for normal muscle contraction and nerve signaling. As filtering slips, these minerals start drifting outside their normal range. Potassium in particular tends to climb because damaged kidneys struggle to clear the excess, and that shift alone can trigger cramping, spasming, or a heavy, weak feeling in your legs that shows up for no reason you can point to. A nationwide patient database tracking tens of thousands of chronic kidney disease cases found that elevated potassium became steadily more common as kidney function declined, rising from a small share of patients in the earlier stages to a much larger share in the more advanced ones. Individually, any one of these 4 signs, the swelling, the fatigue, the nighttime bathroom trips, the cramping, could mean almost nothing on its own. People live with 1 or 2 of them for years and never think twice. But together, especially if you're noticing more than 1 at the same time, they tell a much clearer story about what's happening inside your kidneys right now. If you've checked out for a second, check back in right now. Because sign number 5 is the one almost nobody connects to their kidneys. And out of all 5, it might be the most telling. Persistent, unexplained itching, deep and restless, the kind that seems to come from nowhere rather than from dry winter air or a new soap. Sometimes it's worse at night. Sometimes it moves around your body from one day to the next. Here's the connection. One of your kidney's jobs is clearing out metabolic waste products, byproducts your body generates constantly just from being alive, things like urea. Doctors call this collection of waste uremic toxins. Now, what does that mean in plain terms? Think of it as your body's own trash needing to be picked up on a regular schedule. When kidney filtering slows down, that pickup schedule slips, and those waste products start accumulating in your bloodstream. Researchers believe that buildup irritates nerve endings in the skin, which is what produces that persistent, hard-to-place itch. A prospective study of internal medicine patients across multiple stages of chronic kidney disease, not just the most advanced cases, found that 58% of them reported this kind of itching, and it grew markedly worse as urea and phosphorus levels climbed. This isn't only a late stage, dialysis-related problem the way most people assume. It's already showing up well before that point in people who have never heard the words kidney disease applied to themselves. That's the piece I really want you to sit with. An itch you've been blaming on your skin might actually be your kidneys asking for help, and here's why this sign gets missed more than any of the other four, especially past 50. Skin naturally gets drier and itchier with age anyway, so this symptom has a built-in cover story. You reach for lotion, maybe an antihistamine, and you move on with your day. Most people never think to ask why the itching keeps coming back, no matter what they put on their skin. And most doctors, working through a packed schedule, don't automatically connect a skin complaint back to kidney function either. So now you've got all five: the swelling, the fatigue, the nighttime bathroom trips, the muscle cramping, and this persistent itch that lotion never quite fixes. None of them, on their own, would send most people to get their kidneys checked. That's exactly the problem. Now let's talk about what you actually do with this information. So here's what you actually do with everything you just learned: the swelling, the fatigue, the nighttime bathroom trips, the cramping, and that stubborn itch. 5 concrete steps. Starting today, built to protect the renal reserve we talked about earlier, that spare filtering capacity you want to hang on to for as long as possible. Step 1, ask for the right test. Don't just accept a routine metabolic panel and assume it covers your kidneys. Specifically request your eGFR, which estimates your filtration rate, and a urine albumin to creatinine ratio, which catches protein leakage long before creatinine alone would ever move. If you're over 50, this pair should be part of your annual physical, not something you wait to be offered. Step 2, bring your sodium down to under 2,300 milligrams a day. That's roughly 1 teaspoon of salt total, counting everything, not just what comes out of the shaker. The biggest source isn't your own cooking, it's processed and packaged food. So check labels before you check your seasoning habits. Step 3, hydrate steadily, not aggressively. Spread water intake across the day instead of chugging large amounts at once, and pay extra attention on hot days, or if you're taking a diuretic, since dehydration puts real strain on kidney filtration. Step 4, keep protein intake moderate rather than maximized. The trend toward very high protein diets for muscle preservation after 50 is well-intentioned, but pushing well beyond what your body needs makes your kidneys work harder to clear the byproducts. Reasonable portions, not extremes. Step 5, be cautious with regular over-the-counter anti-inflammatory use, ibuprofen and naproxen in particular. Occasional use is generally fine, but frequent, ongoing use without medical guidance is one of the more common, avoidable stresses on kidney filtration. Try this for 30 days, then ask for those 2 tests again. Give yourself a real before and after, numbers on paper, not just a feeling that the swelling or the itching has eased up a little. Let's talk about a few mistakes I see well, meaning people make constantly, usually while genuinely trying to do the right thing. Mistake 1, assuming that because a supplement is natural, your kidneys can't be hurt by it. Vitamin C is the perfect example. Doctors have documented a real and rising number of kidney injury cases tied directly to high-dose vitamin C, well above what you'd get from food or a basic multivitamin. One hospital review found that this specific type of kidney injury went from essentially unheard of to nearly half of all similar cases within just a couple of years, right around the time high-dose supplements became trendy. The mechanism is straightforward. Extra vitamin C gets converted into oxalate, and oxalate crystals can physically injure kidney tissue when there's more of it than your body can clear. More is not automatically better, even with something sold as harmless. Mistake 2, cutting back on fluids specifically to stop getting up at night to urinate. I understand the logic. Fewer trips to the bathroom sounds like a win. But restricting fluids doesn't fix the underlying reason your kidneys aren't concentrating urine properly overnight, and it adds dehydration on top of a kidney that's already working with less reserve. You're treating the symptom in a way that makes the actual problem worse. Mistake 3, stacking multiple over-the-counter products without realizing they overlap. A daily low-dose aspirin, plus an occasional ibuprofen for joint pain, plus a nighttime cold and flu combination that also contains a pain reliever. Individually, each one seems minor. Added together day after day, that's a steady, invisible workload on your kidneys that most people never connect back to a single choice because it never felt like one. I'll admit, I've made a version of that third mistake myself, reaching for whatever was in the cabinet without reading past the first line on the label. Good thing someone in my house actually reads the fine print. Speaking of medications, since a lot of you are managing more than one prescription by this point in life, let's talk specifically about which ones deserve a closer look with your doctor. I want to be very clear before we go further. Nothing here means you should stop taking a medication your doctor prescribed. It means knowing which ones deserve a kidney function check as part of your regular monitoring, so you and your doctor are making informed decisions together. First, proton pump inhibitors. The acid reflux medications many people take every single day for years, sometimes decades, often without ever revisiting whether they still need them. A large research review combining data from multiple countries, covering over 500,000 patients, found that long-term users were 68% more likely to develop chronic kidney disease than people who didn't take these medications, along with a smaller but still measurable increase in risk of kidney failure. This doesn't mean the medication is dangerous for everyone, and plenty of people genuinely need it. It means long-term use deserves a periodic conversation about whether you still need the full dose, whether a lower dose would do the job, or whether you need it at all anymore. Second, diuretics, commonly prescribed for blood pressure or fluid retention, the very swelling we talked about earlier. These medications work precisely by changing how your kidneys handle sodium, potassium, and fluid balance, which is exactly why regular blood work matters while you're on them. Skipping those follow-up labs means flying blind on the very system the medication is designed to affect. Third, if you're scheduled for a CT scan or any imaging procedure using contrast dye, mention your kidney health beforehand, even if nobody asks you first. Contrast dye is processed through your kidneys, and in someone with reduced function, it can add real strain during that process. None of this is a reason to panic about your prescriptions. It's a reason to bring one simple question to your next appointment: whether your current medications are being weighed against your current kidney function, not just the reason they were originally prescribed years ago. Let's turn everything you've learned today into a 2-minute self-check you can run through right now, before you close this video and get pulled back into your day. Start with the 5 signs. Have you noticed swelling in your ankles, feet, or under your eyes that comes and goes? Fatigue that doesn't match how much you've actually done? Getting up more than once a night to urinate, or noticing foam in the toilet that lingers? Muscle cramping, especially in your calves, that shows up for no clear reason? A persistent itch that no lotion seems to fix? One of those on its own isn't a diagnosis. 2 or more together is worth a conversation with your doctor, and it's worth requesting that EGFR and urine albumin test we talked about earlier by name, rather than assuming your standard panel already covers it. Now layer in your risk profile. Are you over 50? Do you have a family member with kidney disease? Even a distant one? Has your blood pressure ever run high, even if it's controlled now? Have you been a long-term user of anti-inflammatories, proton pump inhibitors, or high-dose supplements? Each yes adds weight to getting tested sooner rather than later, even without a single symptom present. Here's the line between routine follow-up and urgent care. Gradual swelling, ongoing fatigue, nighttime bathroom trips, cramping, itching, these deserve a scheduled appointment, not a trip to the emergency room. But sudden, dramatic changes are different. Urinating very little or not at all over several hours, sudden severe swelling, confusion, chest pain, or real difficulty breathing. Those need emergency care immediately, not a wait-and-see approach. Know the difference, and you'll never waste a moment second guessing which category you're actually dealing with. Write your own results down somewhere you'll actually see again. Your phone notes, a sticky note on the mirror, wherever works. Because the whole point of this checklist is that you use it, not just that you heard it once. Let's bring this all the way back to where we started. Your kidneys can lose a significant piece of their function without a single loud symptom, but they're not actually silent. They've been talking this whole time, through swelling you blamed on a long day, fatigue you blamed on aging, bathroom trips you blamed on getting older, cramps you blamed on nothing in particular, and an itch you blamed on dry skin. Now you know what that language actually sounds like. That's really the whole point of everything we covered today. This was about handing you information your doctor's 7-minute appointment was never built to give you. Information that lets you walk into your next checkup and ask for the exact tests that actually matter, instead of assuming a normal-looking blood panel means everything's fine. If you take one thing from the next 30 days, let it be curiosity instead of worry. Take the protocol seriously for the next 30 days. Watch the swelling, the fatigue, the nighttime trips, the cramping, the itching. Get that EGFR and urine albumin test if you haven't already, and if a family member over 50 comes to mind while you're watching this, send it their way, because chances are they've been brushing off one of these 5 signs too, exactly like you almost did. Then come back and tell me how you feel. And more importantly, tell me what the numbers actually showed. I read every comment, and I genuinely like to know how this played out for you. If this video gave you something you didn't have 20 minutes ago, do me a favor and hit like. It helps this information reach the next person who needs it just as much as you did. Subscribe if you want more straightforward health information without the alarmism. And drop a comment letting me know which of these 5 signs surprised you the most. I read through every single one, and I genuinely look forward